Everybody, thank you again. My name is Matt. I am the COCA president and the camp director of Camp Happy Times here in New Jersey. Um, Next slide, please. So the 5 topics you're going to see on your screen, these are 5 of the main topics that we're going to cover today uh, that camps have approached us about, whether it's Don, Jennifer, or myself, or a board member that they're having issues with or would like more information about. So those are the topics that we're going to try to cover in the next hour. On the next slide, this was sent out to folks just about what the town hall is going to look like, that this is actually your town hall. And while we do have an agenda, it is very fluid. We will get through as much as possible, and that all depends on your input because it is all about you and your campers and camps. What it is not, I can tell you, we do have a pediatric oncologist with us today. Thanks, Dr. K. However, this is not a real scientific conversation about the coronavirus. We really know its effects on all of us physically, but this is a conversation about how it's affecting our camps and programming. It's definitely not a lecture. You're not going to hear me talk the whole time, other than to transition from slide to slide and introduce you to new topics. We are hoping that you are not silent, but if you are taking notes, that's awesome. The more notes you can also share with us, that would be great. So please speak up and ask questions of each other. And that's also why we ask you to introduce yourselves. So the first slide we're going to jump right in is to talk about camp scheduling and operations. Now this slide, the 2 graphs that you see are directly from the survey that we sent out prior to the town halls. So just to take a quick look at them, the first pie chart is all about the state and local restrictions that could affect your camp, whether it be, the max number of people at an event, which is over 90%, or school closings, 76%, et cetera. And the bar graph is your canceled events. So those who have said that they have canceled events in the months of April, May, and June, the blue, yellow, teal color, those are those folks. So many folks who have events in August, according to the survey, they are in basically a wait and see kind of mode right now, and haven't canceled much in August. So love to have a conversation with you all about camp scheduling and operations, so we can start talking about, have you had to reschedule anything? Have you had to cancel anything? What type of criteria did you utilize for the cancellation? And if you have new plans to deliver services, are you talking about if you own your site, what restrictions do you have? If you need to relocate, what's going on? So I'll put it out there to all of you to discuss what's going on with your events.
So Matt, this is Ian from Camp Happy Days. We had a family weekend scheduled for April 3rd through 5th that we were kind of in the, when all this was starting, we weren't sure if we were going to have to cancel or not. And we really kind of at the beginning just said, this is something we need to do. What we've done is December is really busy for us. And with us, we do not have our own site. So any weekend event that we use, that we do, we rent facilities. And so the biggest thing for us has been the fact that not only is our camp having to reschedule, all the other camps are having to reschedule as well that are going on at these sites. Right. And so the first open availability was December. And so one of the things that, with us, we're not directly affiliated with a hospital. So a lot of our money is through grants and government funding. And so we have to have a bunch of, we have to perform overnight events and everything. So we looked at trying to, I think it's allowed us to get a little bit more creative in the planning process. I know that I've talked with Jennifer a couple of times about the idea of the only weekend that we had, like I said, it was April 1st or 3rd through 5th. The next weekend available to us was December 4th through 6th. And so we, it kind of shifts the whole playing. And then our camp is the week of July 4th. And now we're beginning to really look at, is it going to be the safest thing to do camp? And also the fact of the thing that we've been talking about as a staff is we don't want to be the first camp. Like that's the thing. We don't want to be the first camp, and we don't want to be the only camp. And so that's kind of the mindset we've been looking at with it. But rescheduling has kind of been a pain for us because like most of us, we don't have our own site. So that's been the biggest, challenge with it.
This is Cassie with Camp Chemo, and I'm going to kind of echo exactly what Ian's saying, is that we have officially canceled for the summer, or for June. We were scheduled to have camp in June, and we've officially canceled that just because our physicians feel confident that it won't be safe enough for our kids to gather at that point. And I called the site that we rent from, and the next date they have available is in August, but then something that we then have to weigh is how does that affect volunteer recruitment and our physicians, because we are affiliated with the hospital. So all of our medical staff comes from our clinic and inpatient unit. And so what are their schedules looking like now? Because this is obviously not something that they're accustomed to, is being available for a week-long camp in August. But then with all of our college volunteers probably going back to school, all of our teachers getting ready to go back to school, what will their availability be like, and how will that affect not only our ability to recruit our regular volunteers, but then if we get other volunteers, how does that affect kind of the feel of what we do if we have very few returning counselors and the vast majority of new volunteers? What does that do just for our dynamics, and how does that affect our kids as well?
This is Melissa with Rapahope, and our camp is the first camp of COCA, I think. We do the very first week in June, so we're the week before chemo. We've not made a final call yet. I feel like we sort of have. It's just not been said out loud. But one of the things I was hoping we could do, we can't reschedule either, because we don't have our own space. We use another camp, and they're full because, like you were saying, everybody's going to get pushed back, if at all. So my thought was, we will probably do virtual camp using Zoom or whatever, and do something each day when we should be at camp. But also, I wondered if things settle down and there's camps in late July and August, if we could really implement the camper exchange. Like I would pay, use my camp money for this year and send our graduates to someone else's camp that does get to have one towards the end of the summer. If that's the only group I can get to camp this summer, is that something that the later in the year camps, whether it's in our region or a different region, is kind of neither here nor there, is availability in that time frame. So what are your thoughts on that?
Melissa,
this is Cassie. Oh, go ahead.
No, go ahead, Cassie.
I was just going to say that, obviously we'll have to examine that once we get closer to the summer, but I think that's a great idea to kind of pool our resources and see to help each other.
Yeah, because like I said, we're first. We are like, it's April, so to us it's time to go to camp. But I was just hoping that we could, organization wide, that when people say we are definitely having it July, August, whatever, that if there's space, that our graduates collectively get first dibs, if that makes sense.
So, sorry, this is Matt. While you are the first camp, we are probably the last camp because we are the third week of August. And like I said before, we pretty much right now we're just going on with our planning process, our interviews, et cetera, to have camp. And, we're fortunate. The site that we rent, I've been in contact with them, and they're planning that we're coming because it's in August. We only use half of our campsite because the campsite we rent is so large, and I'll go right on record right now as saying that um, I would love to take campers from any camp around the country. If they're
Well, and
available in August, they're more than welcome to come.
it's Melissa again. And what I was picturing was, at least for my crew,
Hmm.
I would send, 2 to 3 counselors with them. Of course,
Yep.
they would have to go through your process,
Hmm.
apply, do exactly what you would do for everybody. But
Yep.
not only would we be sending kids, but we would be sending the help as well, so that you're
Absolutely.
not overburdened trying to get folks to do that.
No, and I would love to have staff come with them as well. I think that, and knowing that I'm increasing my numbers, like I increase my staff every year based on the numbers that I know are coming from our hospitals, because we're affiliated with 7 hospitals. So if there's folks coming from other camps that can send a counselor or two, that's fantastic. I think that would be great. And I could definitely easily say that I would be willing to do that with Rappahope or any other camp. Since we're so late in August, it's going to be till July before we decide what's going on with us. So, thinking about that and thinking about our staff, as Cassie had mentioned, with her staff and possibly changing the time to August, have any of the camps assess the availability of their staff, whether they are paid or volunteer staff, their medical staff, if they're going to be able to make it to camp this year? Has anyone heard from their campers? Any reluctancy with the families?
So we've fortunately, well, I guess unfortunately for our medical person, we brought a medical person on staff for the first time ever this year. And one of the things that was raised with her the other day was, because we have a loose affiliation with the hospital here, but that's where most of our medical staff comes. But she was saying that, she does not know if the medical staff, because of when the timing of our camp is being July 4th, she doesn't know if we're going to have enough medical staff that's going to be, ready and fit to be able to be at camp, looking at the way that, the curve is going. And so that's one of our concerns with it, is making sure that we have the medical staff, working and being able to come, because, a lot of people are, that they take the hospital here does not give them time off for our camp. They have to use their own time to come. And so that's one of the things that we're kind of nervous about, is making sure that we'll have the proper medical amount of staff there.
Hey, this is Madison from Smile Mile. I've been sending out all of our volunteer acceptance emails this week, just, and planning like normal for now. But we have been getting some emails, back saying, hey, I'm in PT school, or hey, I'm in some kind of professional school, and we don't know what our summer's looking like as of now. So, have got a lot of people saying they could still come, but we're also starting to get some emails saying, we don't know what our summer schedule looks like. And that's a little bit unnerving, especially when some of them are guys, and y'all know how hard it is to get guys to come and be volunteers. So definitely a crazy time of lots of uncertainty.
Has anyone heard from any of their campers? I mean, I know campers are excited for camp no matter what, but has anyone heard from campers, or specifically, I guess, families that have shown any reluctancy or anything? I haven't heard much on these town halls in regards to the families themselves. So I'm curious if there's anything else that.
So I got 2 emails yesterday, and they were the first 2 parents to speak out about being nervous about it. One of them, their child, we've kind of made some kind of made some adaptations for them to come to camp in the past, so it's a little bit more difficult with them in general. But the other one actually was a Renaissance parent who she's worried about sending the sibling. And it was kind of the same thing that you've heard on the news and stuff. Her worry was that she did not want to send her child thinking that they could be a carrier. And so I kind of didn't expect that, but we've started to get those conversations in. And being in South Carolina, one of the things that I've spoken with Cassie about is that I want to make sure, if Camp Chemo decides not to have camp, that I don't want it to be, well, we're having camp chemo's not, and Camp Chemo kids feel like, because they can go to both. I don't want them to feel like, I don't want them to feel like they can't come to ours or they shouldn't come to ours. And so it's kind of a really difficult time trying to figure out where to go with families, because it's only, it's going to get worse before it gets better. And those calls are starting to come in now with parents. And so if anyone has a way to kind of handle not only keeping them at ease, because we thought it was a thing of, I really expected it to be more of I'm worried about the health of my child. I didn't really expect right off the bat to be getting, well, I don't want my child to be someone that, can poorly affect someone else's child's health.
Yeah, this is Cassie. We've gotten maybe 5 to 10 emails or parents, because we're in the hospital, that have come in for appointments and said, I've been holding off on registering my kid because I'm not sure if you guys are going to have it, and or just straight out concern for if we are going to have it. So we have parents that are starting to ask, and obviously I've told you all we're not having camp, but no one else in our outside of our hospital knows that, or really outside of our clinic, and our direct care staff knows that we're not having it. We're working on crafting a message to our volunteers and campers about the same time, just because they all communicate with each other and that rumor mill goes so fast. So I would hate for staff to hear it from a family or vice versa. So we're working on crafting a message, just letting them know that it's for sure not going to happen in June. But I think we're just kind of waiting to see what we're going to do. But in there will most definitely be a message that their safety is our first and foremost priority. And so any decision we make will be made on that. And then also wanting to be able to offer them other options if we know of any, or what we will be offering to them instead of camp. So until we figure kind of some more of those details out, we haven't sent any information out, but families and staff are starting to inquire for sure.
Hi, I'm Holly Ellingworth. I work with Friends of Santa Claus, and we do Camp Merry Times every year. We have gone ahead and canceled camp, and we actually are the weekend before Memorial Day every year. So we were planning in May. So it was around this time that we'd made the decision that we were actually taking applications from counselors and campers, and have already just informed them that of our decision. And so far, everybody obviously understands we're kind of in the thick of it right now. We're trying to schedule a one day in August at the same site that we use for a family fun day. So it wouldn't be the sleepover and the actual camp experience we normally get, but we figured that would be better than nothing.
Are there any other thoughts regarding these sections, whether it's camp operations having to do with staffing, as far as accessibility of staffing? Again, I'll say this a lot. The conversation doesn't have to end just because we are switching gears a bit. If another question does come up, please feel free to ask it, even if we backtrack. That's all good. You can also feel free to add it to the chat box, and we'll make sure we get your question asked and answered. But since we are on the topic of staffing, for those who have not canceled yet, or are thinking about it, Bruce is trying to talk but can't get his mic to work. All right, Bruce, do you want? We can, if you'd like to write your question, and we're more than happy to ask it. While he is typing up, just if you can take a look at your screen, this is from the survey that we put out prior to the town hall, and it has to do with staffing. So it's, the first chart is, are you confident you'll be able to recruit sufficient volunteers to cover camp based on last year's level? The blue is the yes at 57%. The other pie chart is, are you confident you'll be able to recruit enough nursing staff, medical staff? And that yes is at 48%. So it's very interesting. And again, this is just a small, snippet from what's going on with our member camps. So talking a bit about staffing and volunteers, let's talk a few minutes for those who are still in the process of, how are you recruiting? How are you interviewing? Has your training pieces changed, shifted from, in-person training or in-person interviews to virtual interviews, virtual training? What are folks up to? What questions do you have regarding these subjects?
This is Bruce with Smile a Mile. I'll jump in. Our programming staff was able to get one of the group new volunteer sessions done before this all hit. And since then, Madison primarily has done Skype interviews with the rest of that group, one-on-one. We're very fortunate in that we have a ton of turning volunteers, so not a lot of new staff that we were having to interview. Our volunteer training was scheduled for the first Saturday in April. Obviously, and that is typically a time when we would require that all returning and new volunteers would gather with us on that Saturday for, a little more than half a day. We are going to instead do some videos. Kelly Madison, our camp director as well, we'll condense that down to 2 hours probably. Give all of these volunteers, a drop dead day as far as when they need to have reviewed all of that. But I think that makes it then even more imperative that we spend significant time with them if and when we have camps later in the summer, so that we're spending, maybe a full day in advance of a camp session commencing, so that we can kind of drill into them and reinforce those things that we won't necessarily be able to highlight in a very abbreviated one-way volunteer session. So Kelly, Matt, if y'all have anything related to that.
This is Madison. Yeah, just to echo on Bruce, we're trying to figure out some different ways to make it fun and interactive too, so people aren't just sitting here watching us for 2 hours, and also making it that we know that they're actually watching it, instead of just turning it on for 2 hours and then filling out a form at the end saying, yes, I signed it. So we've talked about putting like fun little questions in, like a Google form or something like that they have to go down. And so, they'll answer questions about, what does our quality policy say about this? But they'll also answer a question, you know, what's Bruce's middle name? Because we'll randomly slide that in somewhere, you know, in the session. So making it where they have to actually pay attention, but also trying to make it fun. Like we talked about maybe doing like a game or something kind of interactive in the actual videos, so they are staying engaged and aren't just like miserable sitting there for 2 hours. So if y'all have any suggestions of how to make it more fun too, please send them our way, because we're in the very much planning parts of that right now still.
Hey, this is Melissa with Rapid Hope, and we had already done all of that before this even hit, because our counselors, like many of yours, come from all over, and getting in person is kind of difficult. So that we did 3 little videos where we had different people, like we had a med shed person, one of our med shed people, doing a whole thing on the medical side of things at camp. And so we did just that little video. It's going to be a short video, but like yours, we stuck fun stuff in it, and they have to actually take a test through that video so that we know they did take it. And so we have it separated out from medical, and then we have like the basic policy and procedures. That's a separate one. And then we have another one on, I can't remember off the top of my head, but we did it in 3 little videos instead of a 2-hour video. And then each did have a test in it with fun and serious stuff in it. And they can't go to the next one till they finish it. So we've already got all of that in place. And then, like you were saying, Bruce, on Saturday, if we get to have camp, we will be reiterating the highlights and the most important points, and then really getting to know each other, because that's our only opportunity to do that.
Great point.
Melissa, there was a question posed on the chat asking what system you use to make your test in your video training.
Yeah, I'll get that information and make sure I give it to you exactly right and put it in the comment section.
Perfect. Thank you so much.
Hey, this is Shannon with Smile a Mile. As we're talking through this, it just came to my mind, and I haven't even shared this with our staff yet, but in a previous life, I used a solution called Mentimeter that is an interactive presentation solution where you could do something in the form of a Zoom meeting, but it allows your audience to connect via their smartphone. And it also allows them to interact in real time. So you could do gamification in your presentation. So they could be answering questions via their smartphone as you're walking through the meeting. But it also allows them to do feedback via like a chat forum as well. So I think it's maybe $10 a month for a subscription, something like that. Not super price prohibitive. If that's something that, you know, people are trying to find to do real-time training or virtual sessions, that might be something you could explore.
Thank you, Shannon. And there's a link on the side in your chat box with the website for mentimeter.com. If y'all want to copy and paste that so that you have it, or screenshot it so you have it for later. Again, we'll send you the copy of the chat. Yes.
Okay, perfect. That's what I was just going to ask for those of us on phone right now. Will you send that? Oh
yeah, it'll be part of your packet of resources that you'll receive, but it is menti, MENTI, meter.com.
Okay, cool.
Yeah,
thank you.
Any other thoughts regarding staffing, whether it's recruiting, interviewing, training? Okay, not a problem. Again, don't let the conversation end. We can continue it, but someone did talk about, a nice way to transition about, cost efficiency and prohibitive costs and things like that. So we can actually move right into talking about money, because I know that is a hot topic for a lot of folks, being that the majority of folks who had to cancel events the last month and going into April and May were fundraising events. So the slides that you see now, the first pie chart is has your fundraising been affected by the current restrictions? More than 50% said yes. The good side, though, if you want to consider it a good graph, the other chart says is it likely that lack of funds may prevent you from holding camp this year? And 72% said no. I honestly wish it was more, because I do see a 4% that said yes, that it truly will have an effect. So for a few moments, I'd love to discuss with you all what's going on as far as your fundraising events. Have you had to reschedule or outright cancel? Are you thinking of outside the box ways to fundraise? A number of folks, in the survey are concerned with asking donors and sponsors for money at this time. So they've switched gears and done a different type of appeal, if you will. But I'd love to hear from the group as far as what's going on with you in terms of fundraising and donors.
This is Bruce. We were very fortunate. Extremely blessed that our most significant fundraiser on an annual basis was actually on Saturday, February 22nd. So we really missed disaster in a lot of ways by about 3 weeks, because there was a significant event about the same size as ours 3 weeks later scheduled. They've had to postpone it until May. Clearly now I would say they'll be postponing that event until some later date. We've also seen a lot of nonprofits around town who have had to go with, virtual fundraising of what was supposed to be an attendee event. We have an event. Our junior board's largest event is in late June. I'd say we're getting into kind of a dicey little area there, because the last thing that we want to do right now is to be asking the restaurateurs and other retailers around Birmingham to help us out. So we've kind of turned that on its head and said, hey, right now is a time that we need to be reminding folks across Alabama of those retailers, local restaurants who have supported us recently and through the years, who may now be in a situation where they're trying to survive doing curbside pickup of meals or what have you. So on our social media, we've started reminding people, these are folks who have supported Smile a Mile through the years. During this time, please support them. So I just think it's really important for us to kind of refocus right now and look outward. And obviously, I'm hoping, that in the end, all those local restaurateurs make it, and that they remember that Smile a Mile was with them during this tough time. So that's kind of been our approach. We have not been doing really any active fundraising. There are some opportunities that are popping up that are specifically COVID-19 related, and things that we are doing for healthcare professionals at Children's of Alabama, which foundations are willing to fund for us. But overall, I think, we're all going to see the impact of this, and it's just kind of, how you play that to get through this time, hoping that it passes sooner rather than later, and that you're then in position to thrive.
Hey, it's Cassie again. So we are in a slightly different boat being affiliated with the hospital. So we have had to, at least right now, postpone one of our largest fundraisers that the hospital puts on for us. That was scheduled to be at the end of April. Kind of waiting to see if there will be time to reschedule it. But one of the barriers we run into with that is that our foundation that's in charge of all of that stuff has events in the fall. They do a big breast cancer walk in October, and then a children's hospital fundraising event that they do in November that they start planning for in the late summer, early fall. So our window of opportunity is pretty short to reschedule that just on their calendar, because they are the ones that put it on. So we're kind of in a wait and see pattern with that. But all of our marketing and communications come through the hospital and must come through the hospital. They control all of that. And so currently we have obviously taken a very much a back burner, and they have said that the only things that really will be going out on hospital social media or from a hospital marketing is all COVID related. So I'm curious and a little bit worried to see what effect that will have to not have our name and our community in that regard for the next probably several months. So hopefully it won't be huge, but it is one of, I think, the downfalls of being part of a hospital, is that we don't control any of that. So it's more about the bigger picture of what's happening with the hospital, and that's what everybody focuses on.
Cassie, this is Dr. K. We have the same problem being a facility owned by the hospital, but just a reminder, September is Childhood Cancer Awareness Month. It would be a great combination to put those things together and promote camp and childhood cancer awareness in September. So you might remind them of that.
Yeah, we've been trying. That's just been a long struggle, because they do this massive breast cancer awareness walk. And as frustrating as it is, they say that brings in more revenue than anything we do, and that then takes precedent. I feel certain they will definitely do some things for us, and probably more than they typically do, just because they're understanding that our window has been interrupted. But yeah, it's hopefully we'll be able to take advantage of September. And one of the other ways we're looking to try to do that, which we were talking about doing anyway, is really getting fundraising information into the schools, like the American Cancer Society and St. Jude's and lots of other organizations advertise to our schools and say, do fundraisers, Jeans Days, Penny Wars, that sort of stuff. They present them with like a fundraising packet. They make it super easy. And so we are looking to do something like that and get into the schools for September. So hopefully that initiative will prove to be fruitful for us, and that most of this will be behind us, so we can really focus on that and make that something worthwhile.
I understand your challenge with the pink versus gold. We fight the same challenge here.
Yeah, it's a tough one, but
Amen.
I think their cause is worthy as well. So
Right.
have to be
Yeah,
understanding.
exactly. Limited resources for a lot of good causes. We all understand.
Right.
Hi, this is Holly again. We have a ongoing fundraiser that we just have one of those Amazon Smiles accounts, and maybe with people using Amazon more to get things delivered to their home. We've had a lot of families and volunteers and people over the years add that us as the benefactor. So every time they purchase something from Amazon, Amazon donates a small portion to us. That is, it's small and ongoing, but it's something that has been pretty consistent. We also, in September for Childhood Cancer Awareness Month, we do a 5K. We call it the Gold Ribbon Run. We did it last year. That was our first one, and are planning to do it next year. on a little bit of a larger scale. So we're still going forward and planning that as our main event.
Any other thoughts and concerns regarding fundraising? Okay. For the remainder of our time, I'd love to really switch gears. We've been talking a lot about what has been happening to us and things that we are starting to work on moving forward. So I really like to focus the next portion of our time together on our contingency plans. We already had one with our go-to meeting because we realized, two town hall meetings in, that we can play a video, but there'll never be any sound. So the video that is below that Don can hit play, we won't hear anything. However, you'll see the pictures. I'll tell you about. So this, if folks haven't seen this group, this is a group of a cappella singers, students, who work together and through a real team effort and through many practices, scheduled a concert together. And unfortunately, due to the virus, it had to be canceled. But that wasn't good enough for them. They said, they didn't want their hard work and efforts to go to waste. So they actually created a Zoom concert for everyone and put it out there for all to see. You can actually Google it. It's really, really nice. The song that they're singing is one of my favorites. It's Somewhere Over the Rainbow, the original version. So it's absolutely fantastic. So let's really talk about what we can do and how we can help each other with some plans. So the first pie chart on your left is if you cannot hold camp this summer, have you developed plans to bring kids to camp? And the blue is 43% said yes. The caveat to that question was, have you considered virtual programs? And 54% also said yes. So folks are looking at the alternatives, and that's what we really like to discuss now, is what are some of these alternatives? How can we bring camp to our campers? What are some things that folks have thought about, whether it's camp in a box, or webinars, video conferencing, sending arts and craft kits, all that kind of fun stuff. So on the next slide, you'll see just some things that have come up in our conversations with folks at the member camps, but love to hear from you all, what you're already doing, what you're all working on, maybe some things, if folks are doing these things, if they could talk a little bit about it this way, in case someone who wants to do it could ask a question about it, that'd be great.
Hey, Matt, it's Jennifer. I just wanted to
Yes,
jump real quick. Katie Langley had asked a question in the chat box about fundraising. If anyone has done something other than silent or live auction for fundraising events, they of course already do a raffle, but any other ideas would be great if anybody could share. I know we've heard about the 5K. So what else are you guys doing for fundraising?
Hi, this is MJ from Camp Happy Days. Can y'all hear me?
Yes, ma'am.
Cool. What's up, Ian? Something that we've been doing for just the past few years is it's sponsoring kids for things. And so we do a Valentine's Day stuffed animal, and they're like $20 or so. They sing and dance. They're very cute. And we take them to the 3 hospitals that we are incorporated with, and we'll just post on Facebook being like, it's please sponsor Valentine's. It's $25. We'll do other things like sponsor sending a kid to camp, and that goes to about $250. And so there's just other ways of framing it where it's still getting donation, but it almost seems like they understand where that donation is being directed rather than just asking for, any sum of money.
Mm-hmm.
Matt, talking about the contingency plans. One of the things that MJ and I at Camp Happy Days, we really wanted to do was make sure that our kids, we feel like we know, Dr. Mike has this great saying that he talks about camp being camp not being the bubble, but camp being the real world and then taking it out. We really know that, like, not like to us, the big things are we going to have camp? Are we going to do this with all this crazy stuff going on in the world? But for the kids, so much of camp is just seeing the volunteers and like that's what's going to put them at ease during this tough time. And so one of the things that we've developed is we're going to be doing a type of virtual programming that's scheduled where we're hoping to do 2 sessions a week. What we're going to do is we are sending out an email actually today to our volunteers that we know are, we've got a list of about 70, but some of our main volunteers that either run program areas, do programs, or do things on Facebook that we see, and we're asking them to record a video of them leading an arts and craft or, leading a song. We're gonna also have some live videos that we will record of, kids on Facebook, asking certain counselors to, do like a request hour for songs to sing and play. And what we're gonna do is we are going to basically build a virtual programming library so that we are able to not only use it during this, and it gives our kids a chance to see counselors throughout this, because like we're all figuring out, this is such an unknown, and it'll be a familiar face for our parents and our kids to see their counselors and stuff twice a week. But then also a lot of situations when this gets back, a lot of our parents are gonna have to be working overtime, working a lot of stuff to make up hours and stuff, and this is going to be a place where they can go and find resources that they know are going to be not just a YouTube, but people that they know with activities and talking to them and being able to help lead them. So we're really trying to get our volunteers involved because they're not at work, and this is a great time to use that and kind of capitalize on everyone kind of having to take a break and find a new way to connect, and hoping that it can lead to something that we can use for here on out.
Absolutely.
This is Melissa with Rappahope. Last night we actually did a practice run of that kind of thing with just staff from last year's camp. We had such a great time. We did a scavenger hunt. We did a deck of cards, and the host held up a card, and if yours matched his, you were out of the game. So we were very interactive and did a practice thing so we could see how it would work with our campers. And we've decided and we have now on Sunday night one planned with our campers, scavenger hunt and a little something. And what we're going to do is include counselors and or staff a few at a time, because it can get really big and unmanageable if you're not careful, we feel like. So that's kind of what we're doing. We started out last night with just the grown-ups. We're going to do one Sunday or Monday now with just a few of the staff and campers, and then we'll change up the staff and the campers, and we may actually break it down into cabin groups, do our first our youngest kids together with all those counselors, and then do interactive things that are age appropriate and move forward that way. That's something we want to start slowly, because that can take up your time and your life pretty quickly if you're not careful. So we're going to be very intentional with how we do that. And then camp week, we'll really be ready if we do camp from home, which we probably will. We'll be ready to then really work within cabin groups and do some arts things that way, or some videos, so that it's not. I just feel like that's going to be more manageable. So that's kind of where we are right now on those things.
Hey, y'all.
Melissa, this is Don. I have a quick question. Your concept of this, are these in like 1 hour segments or half-hour segments, or how do you visualize?
No longer than a half an hour. So
okay.
definitely a short time frame. Because again, we're kind of, the way I'm looking at it, as is you know, Roz and some of my other staff, is we're now in their homes. And so I feel like the longer we're in their homes, the more likely things could get challenging. So we definitely want to keep it intentionally shorter, if that makes sense.
Yeah.
And then I just saw somebody, Holly, I'm sorry, I'm just kind of taking over for 1 second. It says, can we still apply for grants since camp is canceled? What we're going to be doing is using some of the grant money we've already gotten for Camp Week and hope to get for Camp Week to pay for the subscription to Zoom, because that's going to be camp for us. And then if we get to send at least our graduates to other camps towards the end of the summer, that money will be used still for camp, and we'll put that in any of our new camp grants that we're applying for. If we do send arts and crafts supplies, if we do send other programming fund supplies to our camp families, Camp Week t-shirt, you know, if we still order those and send them, then absolutely that grant money is for camp. Camp just looks different. So the money would still be the same, at least in my opinion.
Hey, y'all, this is Kelly Reese. Kind of echo what Melissa's saying. We're already doing some of the sending the supplies to our campers in the hospital first. And we're kind of, what we've done is provided in those packets that we send. And of course we have, you know, had to work with the hospital, things like that. But also to our families, and Melissa brings up a good point. I mean, the cost actually has the potential to be higher for us this year than an actual true camp, right? If you're having to send supplies or things like that. So kind of like a camp in the box kind of thing. We've put tie-dye kits together and sent those, and inside the tie-dye kits are explanations. We've asked kind of similar things. We've asked our volunteers and those that do arts and crafts to do some tutorials that we can put on our YouTube page, and then we can send those camp in a box kind of supplies to the kids and families and do it either all together, or they can do it independently. So really trying to think of ways that we can still reach them. And then another thing that I talked about last night is we kind of shifted some of our funds that we would have done for camps, and we're really trying to funnel that into the healthcare providers, whether it's providing a meal, providing a snack, or just things like that, because and we're not just focusing on HEMONC. If we're able to do emergency room or things like that, because they really, really need that support from us, and we feel like, given where we are right now, that's really appropriate for the time.
Melissa with Rapid Hope, and then I'll be quiet, probably, maybe not. Yeah, this week I took some Rapid Hope cups with cookies in each of them, with a little thank you note, just that literally said thank you, and took it to our nursing staff, and they handed it out to all the people that help get kids to camp. I just took like 24, I can't remember now, over and just met them at the door, and they took them and gave them to like the administrative person that helps get our kids to camp from just this hospital. We have hospitals, coastally. So, and it went a long, long way. And that is still, to me, camp recruiting, staff recruiting. And it's not hard to make that money make sense and to be reasonable and right, is to support those who support us, just like Bruce said, posting online, but where we can give a little something to somebody, I think makes sense for the people that get our kids to camp. So that's what I did this week.
Hey, it's Jennifer. Kelly, you have a question. Tell everybody about the restrictions that you guys are working through with Children's of Alabama in regards to the tie-dye boxes that you guys have provided.
Okay, yeah, so I was typing in the box, but I'm happy to go over that. We're working very extensively with them. Obviously, there are many rules in place. So we're putting those kits together, taking all the precautions. There's only 2 of us that, work on putting them together. We use gloves, a mask, Clorox wipes. We then put them in individual Ziploc bags. The bags then stay in a Tupperware tub for 4 to 5 days before we take them to the hospital, which we hand over in the circle. Like we're not even allowed at Children's. So we're working with the VPs of medical care to give us kind of I guess some criteria that we can meet, but understanding that there's, it's not like we're just showing up and throwing things out. I mean, we're having to do all the things to make sure that we're not cross-contaminating, that sort of thing. So yeah. Does that answer, Morgan, kind of your question?
Yes, it does.
Great,
Yes,
thanks.
it
So
does.
if there's
Thanks,
anything
Kelly.
else, I'm sorry.
So no, thank you, Kelly, for that. And I encourage everyone that if that is something that you are looking to do, reach out to your local hospital and ask them, are they accepting donations? I know a few hospitals here in Jersey, they're asking for more, PPE than anything else. But, I would definitely reach out to your own individual hospitals to find out if there are any regulations or restrictions and what their policy is on receiving any type of donation, whether it be baked goods or a meal or what have you. But definitely, I'm sure every hospital has their own set of policies and regulations, so you definitely need to double check with them. But thank you, guys. So just, I guess, wrapping up, because we're just over our hour, which is not a problem. I love that the conversation has gone so well. But I definitely, again, encourage everyone to please utilize the resources that you have. There are 30 people on this chat alone, and there are 130 plus 140 member camps out there that you could reach out to. So please feel free to do so. We do have up our COCA resources here, my email, Jennifer, Dawn, as well as our social media accounts. That listserv there, if you are not a member of our listserv, please let Don know so that he can get you in there. It's a great resource. If you send a question out, you're guaranteed to get 10 to 15, hopefully, responses to that question. And, it might be more items that to help you think outside the box or put camp in a box. But please feel free to utilize those resources that you have at your hand, because this is it's a unique opportunity for all of us. I know each individual camp community has their own challenges and their own successes, but we as a COCA community can really help one another as best we can just by reaching out. So I encourage everyone to please reach out and ask the questions and do what you can.
And Matt, real quick, guys, if you are doing like really awesome stuff, please tag COCA as well so we can share it through like all of our stuff. I know that Camp Quality Canada has done some really cool stuff, and like please tag us so we can share it and some of these other camps can see, because it's really everybody's doing some awesome stuff, and we'd love to make sure that everybody in COCA is being able to see it. So not only look to us for stuff, but also be sure and tag us so we can push it forward as well.
Absolutely. We want to share in your success. It's not
Yeah.
just the, we want to be a resource for the questions, but we do want to also share in everybody's success. Because I'm the first one to say I have no problem if somebody is doing something wonderful that I can steal it and use it. So I definitely encourage folks to put themselves out there. There are a lot of camps that are doing phenomenal things, and we all just want to be a part of it as much as we can. On the next slide and on our website, the COCAI.org website, is a 5-minute brief survey that talks about this town hall specifically. What did you like about it? What are your key takeaways? All those results will be shared with our membership. But it's also a way for us to understand what y'all are thinking, what y'all are going through, and how we can be a better resource for you. These are our first town halls that COCA has ever had. So there is a section in the survey asking for feedback about the town hall setup as well. And also what topics would you like to see along this virus line, but also in the future, whether we do a full town hall just for medical teams or a town hall just on contingency plans. Whatever y'all put in there, we'll do our best to make sure that it happens. But thank you all so much for being on this call today. I greatly appreciate you taking the time out of your schedules to offer out what your camp is doing. I do hope that y'all take something away from this chat. And we really do appreciate it. We wish you all the best of health, and for you, your families, and your campers and staff, and everyone in your community. So bless you all, and good luck with everything.
Thanks, Matt. Thanks, John.
Matt,
you.
Thanks for everything. Stay safe and healthy.
You all too.
Thank y'all.
You can hear everyone signing off.
And Don put it up. Thanks, Don. I hope everyone does take away more than 2% of what we
I
talked
don't
about.
know if they saw the diagram.
We'll have to make sure the next one we'll add it. We'll say it earlier.
Hey, Jessica, we're going to be the state of South Carolina. We're going to get on a bus and come down to Toomer's Corner and take all that toilet paper that you guys have wasted and bring it back.
Oh no.
So I know it's been a while since you guys have hung some up there, but it's until next time. But thank you guys for this, and I'm sure I'll bother you guys here later.
Ian, are we going to talk today?
Yeah. It's been, as you can imagine, it's been pretty crazy. But yeah, I got a bunch of stuff, so I'll give you a call here a little later.
Okay. All right. I have 2 more region meeting town halls. Noon my time, maybe. I don't know.
Yeah, noon your time and 5 your time.
Yeah.
Okay.
So
I'll call in between the two.
okay. All right.
Hi, Kay.
Thank you for being on these calls, Kay.
Yeah, I asked Kay to stay on the line. I just wanted to get her feedback on whether a town hall like this specifically for medical directors would be worthwhile to hold or useful.
I think so. The question will be whether or not you can get us all together. I think that's going to be your biggest challenge right now. Personal recommendation would be it would probably have to be an evening time.
That was my suggestion.
Excuse me. Because I think with clinics and stuff, although to be fair, I ended up with free time I wasn't expecting because I was supposed to be gone to meetings that all got canceled because of the trips. So I think the concept is great if we can find a couple times where people would participate, because I think it would be a very different conversation, excuse me, with the medical people versus program directors, because we just have different things we're thinking about right now.
Yes.
And obviously stuff that all goes together. We can't do one without the other, but I know like for us, so we haven't, just one second, I'm going to close my door.
Jen, we can reach out to Tracy Gaslin and actually probably American Camp Association to see if they have somebody there that could participate as well.
So I listened to that webinar that she invited us to, excuse me. And overall, I thought it was a good talk, but it was not medical camp specific enough. So something they certainly, I think, could be part of the conversation, but it's likely going to need to be driven by our group.
Yeah.
And potentially, depending on the time we can find it, I might ask one of our infectious disease doctors if they might be part of it. I think they'd be willing to at least give some thoughts. As we've already talked about, we haven't canceled our camp for sure yet. Ours is scheduled June like 8th or 9th. I think whatever that Monday would be.
You're the first one on the accreditation visit list.
Yeah, I mean, we're early on. We're trying really hard not to cancel because all of us want to have it. Sanford is very much in support of us doing it because they know how important it is. But at the same time, it's almost, a part of me almost wishes that there wouldn't be a question, you know, if they extend the mass gathering rule past the 8-week mark. Right now, we're about 2 weeks outside that window, so we'd still be okay from that standpoint. If they extended it all, then camp is going to have to be canceled. And it's actually an easier question than figuring out how to actually have it that quickly after the mass gathering rule gets released, if it does. You know, then you got to deal with, how do I screen patients? How do I decide who can come? What's a risk factor that means they have to stay home? You know, I know there was some discussion in the town hall last night about not taking people on treatment. I get that idea, but that feels a little like, well, but our oncology camp is for kids on treatment.
I agree.
You know, so all of these things are in our heads, and we really don't have the ability to do some of the virtual camps